Welcome to our Chronic Pain Alternatives to Opioids workshop. My name is Dr. Kali Hewlett, founder of the Back Pain and Joint Center of Texas. I'm a trained chiropractor who's also board certified in treating chronic pain and neuropathy. What that means is for the last 15 years, I have dedicated my career to finding and providing the best non-surgical, non-pharmaceutical treatments for my patients. In fact, our clinic was one of the first in the area to become what's known as an integrated healthcare facility. What that means is we are a chiropractic clinic. We have chiropractors on our team. We're also a medical facility. We have medical providers on our team. And what we've done is brought the best of both chiropractic and medicine together to provide very unique treatments that do not involve prescription pain meds and do not involve surgery. And we've been helping people get out of pain, get off pain medication, and avoid surgery for years now. So today, I'm going to share with you some of the best practices regarding pain. So let's get started. Our goal today is to do two things. Number one, to educate you about treatments you may not have been aware of prior to today when it comes to pain management. And number two, to give you the resources to actually get the treatment you need to get out of pain. Let's start though. What is the purpose of pain? All right, so in this first picture, we see someone who has touched a hot stove with their hand and they're screaming and their hand's glowing. What purpose did pain serve for this picture here? What purpose?
Let them know there's danger.
Let them know there's danger.
Something's wrong.
Something's wrong, right? It's burning, danger, pull the hand back, right?
Pull the hand back.
Don't touch it. Imagine if this person didn't feel any pain. Or imagine maybe they took a medication which said you won't feel pain in your hand, and they touched the hot stove and didn't feel it. Is there danger in that? What would happen to their skin? It would just melt off. Right? What would happen if they left it there for 30 seconds? Or a minute? Or maybe they were talking to a friend and left it on a burning stove for 5 minutes. Right? It would completely destroy their hand. Fortunately though, there's pain and they know danger, back off. All right, here's another picture. Let's say you were roaming through the woods and you came across a poisonous cobra viper and it bit you and you said, ouch, gosh, that hurts. I wish I didn't feel that because that's really annoying. The pain from fangs of a snake going into your leg, is that a good thing or a bad thing?
It's a good thing.
It's a good thing, yes. Why in the world would it be good to feel the pain of a snake bite?
I know something happened and now I can be concerned about it.
Exactly, you know something happened. You may not know what happened, but you know something punctured your skin and is now in your bloodstream that potentially shouldn't be there. Imagine if you didn't feel that snake bite and now venom was circulating through your system. What would happen then? So I always joke that pain is the gift that nobody wants. I get it, nobody wants to burn their hand, nobody wants to have a snake bite, but it's the gift that tells us something is wrong. So think of it as, and it was mentioned earlier, pain is an alarm system. It is an intelligent way, when our bodies were created, it was an intelligent way for our brain to know if there was something dangerous, something was wrong, or something was damaged. Now the question is, because we live in a modern society, do we choose to ignore the warning system, or do we seek to find out what the pain is telling us? Right? That's a question everyone has to identify and ask for themselves. I have a little alarm picture here. Imagine if there was a fire in your house and the alarm started going off and you're like, oh my gosh, it's 3 a.m. Why is this? This is so annoying, right? And without going to find the fire or what's wrong, you just rip the batteries out and now you don't hear it anymore. Is there danger for you and your family?
Yeah.
Right? So we don't want to take the batteries out. We don't want to mute the pain. Like someone mentioned, we want to find out what is the pain trying to tell us. So when it comes to back pain, what is the pain trying to tell us? Is there a pinched nerve? Is there a tumor growing in my spine that's pinching a nerve? Do I have a bulging disc? Did I pull a muscle? Right? We don't know, but we know the pain is telling us something, and we need to find out what the pain is trying to tell us and what is actually causing it. Now let's get into opioids, because this is where it gets interesting for so many of our patients. How do opioids work? All right. It's first important to understand that opioids, that they attach to proteins called opioid receptors in the nerve cells, in the brain, in the spinal cord, in the gut. And this is the key part. All right. I want you to remember this. When this happened, opioids block pain messages from the body to the spinal cord and brain. They block pain messages. Now, for some people, when I have a patient coming here in pain, they're like, oh my gosh, please block the pain messages. I just want to feel better. But if it was a snake bite or a burning hand, do you want to block the pain messages? Or would you rather know something's wrong? Again, the purpose of pain is to alert us of danger that something is wrong. And so there is danger in blocking messages. If we block that message, we mentioned earlier, we damage and create permanent damage to our hand and the skin. If we block that pain message, we have venom going through our body, which could kill us. And so again, there is danger in ignoring the pain and warning signs. Why are opioids dangerous? We know that we're in an opioid epidemic. It is Overdose Awareness Month. Here's some information out of Johns Hopkins Medicine. They said it only takes a couple of weeks to become physically dependent. Think about that. Physically dependent. Your body physically is dependent and needs this medication to get through the day. That's what we call an addict. They need something. Their body needs it. It's not just, it'd be nice if I had one. Like, they physically need it, right? So only a couple weeks to become physically dependent on an opioid. However, some studies say even after the first dose, physiological changes start to occur. That's why we have an opioid crisis. And when people become addicted and their doctors realize it, they say, okay, we're going to stop prescribing these, but the dependency is there. So when the legal sources are cut off, where do they turn to? Street drugs. And heroin is the number one reason, well, let me rephrase that. Heroin is the number one drug people turn to after being addicted to an opioid. The number one cause of heroin use in our country starts with back pain. A prescription for an opioid. They no longer prescribe that opioid, but the physical dependency is created. Now they turn to cheaper, illegal sources to get that same chemical response in the body, and they turn to heroin. So a couple weeks ago, I was talking to Constable Cash here in the area. And for the past several decades, he has been part of the narcotics division. And a few years ago, he was responsible in helping to lead a group that shut down the opioid clinics in Montgomery County. And he said heroin use in Montgomery County was like minimal to non-existent for years. It was there, but it was very, very small. When we started shutting down the opioid clinics, heroin skyrocketed in Montgomery County. And it still is at higher levels than ever before. And so some of you may have seen some stories in the news recently. Currently there's a $26 billion, yes, that's what they be. There is currently a $26 billion settlement that's in the works right now. And what's happened, the manufacturers and distributors of the opioids, they have been found guilty of doing a few things. Here's a few things that they did. One, the manufacturer of some of these opioids, Oxycontin and one, they withheld studies. So when they made the drug, they came out and said, hey, FDA, this is a great pain medication. It helps patients and it's less addictive than what's currently on the market. FDA said, this is great. Show us the research. They gave them the research that they wanted to. Now the pharmaceutical reps went around to the doctor's office, says, doctors, we have something great. We know you have patients in pain. We have a medication for you that is less addictive than what is currently on the market and it works better. So they said, this is great. And they started prescribing like crazy. Well, as time went on, the doctors realized, wait a minute, this is not less addictive. This is more addictive. Something's not adding up here. Well, come to find out, the company who manufactured these actually withheld the studies. They knew it was more addictive. They withheld the studies so they could get it approved by the FDA. By that time, though, there had been millions of Americans that had taken these and had become addicted already. So they withheld information. They lied to the FDA. And the distributors are supposed to have a checks and balances. For example, if I'm a distributor of medication and this doctor is ordering 1,000 pills per month for a patient, that should be a red flag. However, they ignored the checks and balances that were in place. And so there's a $26 billion lawsuit throughout many states right now because of what's happened. So what are our options then? What are the options? If a pill is not going to fix our problem, well, will it? Let's go back there. Right here we have someone with a finger that had stitches. and we have a broken bone. Is there a pill that will fix this?
No.
No, right? No. How about the broken bone? Will a pill fix that broken bone? No, right? I've had stitches, I've had broken bones. My son broke 2 of his bones last year, right? There is not a pill that fixes broken bones, all right? Now, what about this though? If someone has elbow pain, maybe tennis elbow, golf elbow, right? Or they tore a ligament, will a pill fix the tear?
No.
What about if someone has a torn rotator cuff? Will a pain medication fix that?
No.
What about if someone has a torn tendon in their wrist? Or if they have arthritis or degeneration in their knee? Or if they have a bulging disc in their back? Or a pinched nerve? Is a pill going to fix any of those things? No. Okay. Now I already know, so some of you are thinking this, and it's okay. You're saying, okay, it's not going to fix it, but I got to feel better, like I got to get through the night. So what's the solution? What do I do? It reminds me of a few years back when it was the Friday after Thanksgiving and it felt like someone punched me in the jaw. No one actually punched me in my jaw. What happened was I had a dental pain. Right? One of the tooth in the very far back side was just killing. And I didn't want to bother my dentist, even though I had his personal cell phone. I was like, it's Thanksgiving weekend, let him be with his family. Monday morning, I text him first thing. I'm like, hey doc, something's happened. It hurts bad. I couldn't sleep for the last few nights. He's like, hey, come see me during lunch. I'll get you taken care of. So I somehow get through the morning shift of seeing patients. I go to his office. He says, look, it looks like you may have some nerve damage there. I need to send you to my endodontist who's just upstairs. He'll do some tests. But I know you're hurting, and I can't believe you lasted this long. Here's a prescription, right? This is going to last 2 weeks. That'll give us enough time to find out what's causing the pain, is the nerve damage, and then get any treatment needed to actually fix it. But it's only going to last 2 weeks, Carla, so make sure you keep these appointments. I said, all right, doc, fair enough. So I took the pill, right? By the afternoon shift, I was like, it's gone. It's a miracle. I have no pain. Like, he must have been wrong. Like, there's no nerve damage. If there was nerve damage, I wouldn't feel no pain right now, right? And so I went through that afternoon, and it was like nothing ever happened. Now, fortunately, because we had that conversation, I knew it didn't fix my tooth. I knew it was just giving me some temporary relief. But I had a great dentist who educated me and said, the pain medication will let you get through the day, let you be able to work, while at the same time, we're going to work on fixing the problem. And sure enough, I had to have some dental work done. I got it completed in the 2-week window. After 2 weeks, I didn't ask him for any more medication because we fixed the problem. And so that's actually the best combination. That's what we see works best for the patients that come see us, or really for any patient, right? And so if it hurts, there are non-opioid options for relief. Here are just a couple, right? Acetaminophen, known as Tylenol. You have non-steroidal anti-inflammatories like aspirin or ibuprofen, right? And there are a few other ones out there, but there are options out there that are not opioids, that are not as addictive, that will not create a dependency where you can still get some temporary relief. I say temporary because we know it's not going to fix the problem. And if you notice, I put an and, caps, A-N-D, and. It is essential that as you're taking some medication for relief, you're at the same time seeking treatment to fix the problem, just like I did with my tooth. I've worked with a lot of doctors in the past several years that I've been in practice, many pain management doctors, and they're split into 2 camps. Some pain management docs, they're content just writing a script, doing an injection, saying, see you later. What I did is the best available. Just keep taking the pills I give you, come back every 3 to 6 months for a shot. That's all you need. I'll talk to them, and they'll be like, oh, you're one of those guys who chiropractor and you rehab, and yeah, you got a medical guy with you, but whatever. He's probably not a real medical guy, because if he was, he'd be like I would and would just inject and prescribe, because that's what the good guys do. And they have no desire to have a relationship with us or any clinic like ours. They simply inject, prescribe. That's their MO. They don't want to learn anymore. For those ones, I think they're the biggest disservice to our community. I think those are the biggest disservice to you, to your family, because all they're doing is giving medication. They're not actually fixing the problem, right? And you keep going back, getting the injection, getting the refills. However, there are also many great doctors I've met with, great pain management doctors who say, hey, I know I don't fix anything. Like, I'm going to give them some medication, I'm going to inject them, give them a prescription, but it's not going to fix anything. I don't want to see them keep coming to me every month or 3 months with the same problem, So I'm glad we connected, because I'm going to refer him over to your clinic. So that way, while the medication's working, you can work on unpinching the nerve, fix whatever's damaged. Medication wears off, they're better, life is good. Right? If you don't have a doctor like that, find one like that who has a relationship where, yes, you can get the best of both worlds of some medication that's not addictive, right, in nature, to get you some temporary relief, while at the same time getting the treatments to fix the problem. That is the winning combination. Back and joint pain is the number one reason that opioids have been prescribed. Number one reason, right? Here's an x-ray of a neck and of a knee, right? Here's an x-ray of a neck where, if you can see, there's some bone spurs, there's arthritis, there's disc degeneration, right? If we were to look at the MRI of this patient, there'd be compression on the spinal cord. This patient may have neck pain, they may have shoulder, arm pain, numbness and tingling down the hands. Right, here's another one where we see a normal knee, and then we see a knee that it looks like it's almost bone on bone and touching. This patient has severe knee arthritis. This patient is going to have trouble walking up and down stairs. They may even use a walker or wheelchair because the pain's so bad. Well, what caused? We're going to switch gears here. We're going to connect the dots for you in a moment. Yes, this is a tire. It's not a spine. But what caused this?
Out of alignment.
Say it. Out of alignment. Something was out of alignment. And now part of the tire is worn, bald, and the other part is normal. Something happened. Maybe this person was driving down the road, right, hit a curb accidentally, and it went out of alignment. And they didn't really pay much attention to it. But as time went on, now you have a bald part of the tire and a normal part of the tire. Right? What causes part of the knee joint to degenerate faster than the other part of the knee joint? Out of alignment, the same thing. When something is out of balance, it's going to wear and tear abnormally. It's the same thing for the next x-ray. Why do these bones and discs look normal, and these look like they're 20 years older? And they have bone spurs, and they have disc degeneration. Now, here's a myth, and I want to bust this myth right now because I hear it from so many people. I'll show them an x-ray. We'll take an x-ray or an MRI, and we'll show it to them. They'll be like, oh, well, isn't that genetic? And I say, okay, how old are these bones up here that look normal and healthy? And they'll say, well, they're 45 years old. That's how old I am. Perfect. Okay. So these ones are 45 years old, and they look pretty healthy. How old are these ones down here that have disc degeneration and nerve compression? And they say, well, I reckon they're 45-year-old too. I say, So same age, but yet one looks 20 years older. It's not because of genetics, it's because something caused it to be out of balance. Maybe it was an old football injury or a sports injury or gymnastics. Maybe it was because someone for a profession that they're bending and lifting and twisting all day. Or someone does computer work and they're hunched over a computer all day. Or someone had a car accident or a one-time trauma or a branch fell on their head. It could have been a variety of things, but something happened to make it go out of alignment, and now it wears and tears faster than it should, creating pain. All right? So when I talk about balance, think of the human body as a series of pulleys. Right? Here we see a flagpole, and if you ever have put a flagpole or run a flag up a pole, there's a pulley up top, and you pull on one side of the string, and the flag goes up, and if you want to bring it down, it's the opposite. Well, anytime we move any part of our body, for example, if I wanted to eat something, I have biceps and triceps, and I would use those, and like a pulley system, my elbow bends, my wrist bends, and I'm able to eat. So any movement we do is simply because our body is composed of hundreds of pulleys. And as long as that pulley system is working correctly, life is good, right? And typically we don't have joint pain or muscle pain or back pain, again, which is the number one reason people seek out opioids and pain prescription medication. So I ask you, is this pulley system in balance? Normal, abnormal? Or is this pulley system out of balance?
Out of balance.
Out of balance, right? What about this pulley system? Here we see normal bones, normal disc up here, but now we get to the bottom, we see some severe disc degeneration. Is the pulley system for moving this area working like it's supposed to, or not in balance? All right. So when we can understand and identify what is actually causing the pain, now we know what the treatments are. is there an opioid or any other pain medication that's going to restore balance to this knee joint? Is there an opioid or any other pain medication that's going to restore balance to that pulley system?
No.
All right? And so again, when we know the problem and we can understand it, the solution becomes much clearer. So what is the solution? Right? If you've ever had a tire out of alignment, right? I have, right? If the tires are out of alignment, whether they're in or out, what's the solution?
Get in alignment.
Get in alignment. Everybody knows that. Take it to the auto shop. They will fix the alignment, so now it's pointing the right direction. Well, if things are out of alignment, out of balance in the body, what's the solution?
Realign it.
Realign it. The exact same thing that we do with the tires. We realign it. Now, some people say, okay, it's starting to make sense, Doc. I got it. The tire's out of alignment. My body's out of alignment. Got to fix it. Well, okay. Let's help connect some of the dots here. What is the solution? I'm going to go over a basic 3-step solution to treating muscle, back, and joint pain. All right? Step 1, fix the alignment. Step 2, we have to retrain the muscle movements to keep it in proper alignment. And then step 3, if there's been damage in that area, we need to repair the damage. So let's talk about each of those briefly. 1, how do we fix the alignment? This is a picture of a spine, so we see bones and disc and nerves. Everything's lined up, and these nerves right here, they're nice and healthy. They're happy. They're not pinched, so they're not screaming pain signals to the brain. However, over here on this picture, you're going to notice bone is lined up. However, this bone is pushed back. And again, it could have been caused by car accident, repetitive motion, sitting too long, bad posture. Several different things could have caused that. But when the bone moved back, can y'all see this nerve here?
Yes.
Right? Does that look like a happy nerve or a nerve that's going to say ouch? Right?
Ouch.
That's the ouch nerve. That's what sends pain signals to the brain saying we have a problem. We have a bulging disc. We have a pinched nerve. We need to identify what's causing it so we can do the proper treatment. So one of the things which we do in the office is called a chiropractic adjustment. Right? For over 100 years, chiropractors have been helping identify where bones are out of place, where nerves are being pinched, and realigning the spine without surgery and without prescription medications, and been doing a phenomenal job. So step 1, chiropractic adjustment to take pressure off the nerves and put the spine back in alignment. Now people will say, okay, we got it. We put it back in alignment, but will it stay there? Well, that's where we have to go to solution 2. And solution 1, 2, and 3, they all work synergistically together. They all work together. We have to retrain the muscle movements, because once we put something in alignment, it may go back out of alignment depending on how long. For example, if your back or if your knee joint or your shoulder, if it's been out of alignment for 5, 10, maybe 15 months, 5, 10, maybe 15 years, it's going to think that out of alignment is normal. So we put it back where it needs to be, but it doesn't stay there. So number 2, we have to retrain the muscle movements and fix the pulley system. And so to talk about that, we have a very special guest who's with us today. Taylor from OC Wellness is going to talk a few minutes about retraining muscle movements and the role they play in treating pain. So Taylor, I'm going to hand over to you here. I'm going to swap off the mic. All right, here you go.
All right, thank you so much. Thank you. Thank you, Dr. Hewlett. Thank you, everybody, for coming today. I'm just going to get these little suckers on myself. There we go. There we go. Hey, what's up, everybody? My name is Taylor Kelby. I'm owner of the OC Wellness here in Conroe, Texas. So, firstly, today I want to go over pain management and its lions, tigers, and bears, right? So there's many different ways to address pain management, from chiropractic care to breathing, nutrition, to movement, to stress relief, to opioids. But today we're only just going to talk about movement. So I want to go ahead and take a moment before we go on to this next slide and talk about the difference between local movement and global movement. So say, for instance, somebody tore their ACL, and when somebody tears their ACL, they go through this series of physical therapy, of recovery, and they don't typically start as soon as they get back. They don't start doing some squat jumps and they don't go right back on the athletic field. They start with linear movement here, forward and back, just retraining the knee joint and its basic motions, and then they might then increase to recruiting the hip, up, out, and then they might come to some lateral motions here, and then they might finally decide, okay, now I might get a ball and I might put it behind my back, I might take away some of my body weight so I could start coming into a squat and then coming back up, and then they might decide, okay, now I'm ready to go ahead and turn. I might be ready to do a global movement, which is going out of that forward, that linear, that straight line motion, and coming up and saying, all right, I can take this knee and I can now step out over to the side, and I can step up, and then I can step back down, and then I can come back. All right, so that would be considered a global movement when I'm using my entire body and I'm crossing into different planes. I'm not utilizing the knee as a joint to stabilize in one singular motion. I'm recruiting everything around the knee to stabilize in all aspects around the knee. That is very, very important for day-to-day life. Can you walk in a straight line without having to turn at any point? No. You can't. My wife thought I was crazy whenever I tried to prove that point at the house. I kept trying to walk in a straight line, and then I came up and I hit a wall, and she said, why do you keep running into that wall? I said, because I'm trying to figure out how to get around the wall without turning. I can't do it. And yeah, I'm the crazy husband, but that's okay. And my wife loves me. So, and that same concept for the knee, for the ACL, can be applied to the shoulder. If you tear your rotator cuff, do you go right back, if you're a baseball player, do you go right back out to throwing right back into the game, or do you take a little bit of time? Do you start with some localized movements, maybe here with some internal, external rotation? Do we try to extend the arm up and extend the arm down? Do we try to recruit the shoulder blade and get the shoulder blade back into motion? Do we start localized? Yeah, because that's safer. If I were to go out and I were to just jump right back into the game and start throwing 90 mile an hour, which I can't do, by the way, fastballs, then I might end up hurting myself a lot quicker and just continue to do it over and over again. So we'd start localized, we'd start working to global, and now let's go ahead and take global to another level. So from this motion here, when I talked about the knee, and I took my leg up and I stepped here and then I stepped up, you can take that further by then throwing a ball to somebody in front of you, because life is precarious, right? We don't always know, am I actually going to be okay as I step up the stairs, or is a cat going to run under my feet, and is my knee going to have to go, oh gosh, I have to get away from that cat? Yes, that happens to me, and that's why I used it. I do that all the time, and I hurt my knee one time trying to get away from that cat, and I thought, dang it, I'm not supposed to let this happen to myself. But it happens sometimes because life is precarious and sometimes circumstances happen. So we want to train our bodies the best way that we can to be prepared for those uncertain circumstances. So when we talk about the pitcher throwing the ball, a pitcher doesn't just stand here with their legs underneath, their feet underneath their hips and say, hey guys, I'm ready, let's go. They don't. No, you see these guys, they have one foot in front of the other, they bring that ball back, sometimes they lift that front leg and they turn and they rotate those hips, and then everything is engaged. This is a real global movement from my toes all the way up to the top of my head, the atlas of my head. So if I'm here, that's global. These are things that we want to try to work into. So when you're trying to manage your pain, you want to be going from those local to those global scenarios, to retraining and re-educating your body and your muscle to be able to carry and react to all of these situations that occur throughout life. Now, some common movement thoughts. So a big one for me, something that I really try to drive home with people is, we have a lot of people say that there's this big movement, we should start running on softer surfaces or get softer shoes. I know Skechers has those Tempur-Pedic ones that just feel so cushiony and they feel so good. But we can't go too many places in life avoiding that impact. And that was the big cause of that push. Hey, we need to be less impactful on our joints. Well, I can see how that happened, and I do agree with that. Our joints do deserve less impact. However, we do have systems in place within our body naturally to help our body absorb impact, and that's through our tissue, our ligaments, our muscle tissue. So if we can train our body, and the biggest way that I like to do that, by the way, is through something called eccentric isometrics. So an eccentric motion is when Dr. Eula was so gracefully talking about the pulley system. When your muscle is getting pulled apart, for instance, in that squat, When you're going down, your muscle is getting pulled apart. It's lengthened here. This is the most unstable portion of a squat, right here at the bottom and on the way down. So taking it slow, eccentric, when everything's lengthening and stretching and pulling apart, and then holding isometric, isolated, we're holding here, and then we're coming up. Now we're training our body. Think of a football player and a lineman, and I'm going to reuse that again when I get down here. Do you want, as a lineman, going up against somebody else, do you want your body to be able to push off quickly or give less quickly? What's more important? If your body does it, well, to not allow yourself to be pushed. As a lineman, it's more important for you to hold the person there. At the end of the day, if you could just hold them, I'm begging you, hold them, keep them away from me. I don't care if you get them to the ground at all. Just keep them away from me. Don't let your body give. The same thing whenever you're stepping and trying to avoid that cat on the stairs. You want your body to be able to react, to have all of the tissue around that joint and everything around that joint to be able to say, hey, hold on, I can catch myself here. I can absorb that impact. Same thing when you're running. You want everything around your ankle, everything around your knee, everything around your back to be trained to carry the load, to give less. All that tissue needs to be trained repeatedly, repetitively, habitually, not to give, because it's what's going to help save your joints. Now, I already went into the lineman part of this, so I want to go ahead and reuse it in a different manner. So when you see people and you see them on machines, and a lot of people, they think that, especially baby boomers, they think that I need to go to the gym and I need to get on machines, and that's about the extent of my movement. So when you're on the line, do you have your back up against the wall? No. How many times in life do you catch yourself with your back up against the wall pushing something away from you or trying to push something anywhere? It's very rare. My wife was one of those people that thought that she could put her back up against the wall because we had a really heavy box, and she said, no, I can get it up the stairs. So she put her back up against the wall and she started pushing with her feet, and then, she got it, to where her legs could fully extend, and then her back had to come off the wall, and then all of a sudden her core couldn't support the leverage that she was trying to create, and then she just kind of fell back and the box rolled into her. And I did record it, and if anybody wants a copy of that video, I can send it to you, and I will get hit, but it's worth it. So now let's go into yoga, as we see over here in that far top left picture. So I love yoga, I do teach yoga, and I do believe that there's great benefit within it. However, one of the common downfalls of most yoga practice is that it does focus in that straight line fashion. Whether it's a straight line here or it's a straight line here, very rarely, unless you're doing specific types of yoga, are you crossing planes and ending up here. So we want to be able to make sure that at some point in our training regimen for our bodies or our movement, that we are crossing planes. We are teaching our body. The hip is a great example of that, as we don't just want to train the hip here like a toy soldier, or one of those little tippy bird ducks or something. That's typically what comes to my mind at first. We want to be able to train our hip to come here, because typically, fun fact, whenever people say that they fell and they broke their hip, the hip typically broke before they fell. It's that femoral neck, that little thing that goes right here. That's the thing that typically breaks, and then you fall because of that. So there's a ton of musculature around that hip that you want to be able to work and train all of it to protect that hip. That hip deserves protection just like the rest of your joints. Now, weightlifting and CrossFit, something that a lot of people like to do, and I'm not knocking any of these things, anybody, I'm really not. I just want to make sure that if you are doing these things, that you're making sure that you are doing other forms of movement as well, as your body does deserve that. So typically, most of these things, a deadlift, a clean and jerk, a clean and press, whenever we come up, we're still working in that straight line. We're still working here, we're still there. We're not working the external rotators of our hip. We're not working the external rotators of our shoulder. We're not coming way out here and targeting all four aspects of our rotator cuff. Those things are important to be able to train and to make sure that they're staying healthy. So these are all movements that we want to consider when we're thinking about, okay, I've gone through these localized rehabilitation drills for my joints, for my body. Now I'm working globally. How much further can I take this global concept? How much further can I challenge my body to react and adapt to these precarious situations? Because again, life is very uncertain, and a lot of times, yes, we do go through habits. A lot of pain is set on by habitual activity, but oftentimes we do have those acute occurrences when pain is onset by just some random occurrence of events. Now, I hope I was able to revolutionize some of your thinking here today when it comes to movement, getting you out of those straight lines, getting you into multiplanar movement, re-educating the body, its nervous system, its muscular system, working the body in a very neuromuscular way to where the brain is cognitively sending those signals down to the body to be able to react for whatever you want to throw at it. You don't want to reach that point in your life that you're thinking, I just can't do the things that I used to anymore. And that's something that I hear quite a bit, and it's not fun. It's not fun for them, and it's not fun to hear. So there is a way out of that, I promise. There's a way to prevent it, there's a way to manage it, and it's only as hard as you want it to be. So thank you, everybody. I'm Taylor Cobian, owner of the OC Wellness in Conroe, Texas. I'm going to go ahead and pass this back over to Dr. Hewlett. Thank you all so much.
Perfect. Thank you, Taylor. Make sure you guys capture his info on the slide here. It's theocwellness.com. Taylor is a wealth of information in regards to muscle movement patterns, nutrition, and so much more. So thank you. All right, so let's go on to solution 3. We've talked about solution 1, fixing the alignment. Solution number 2, retraining muscle movement patterns. And now let's go to solution number 3, repairing the damage. And we utilize a very specialized technique called regenerative medicine in the form of PRP. And so what that means is where a joint may look like this and bones are together and looks like they're almost touching and the space between there is gone, with PRP and regenerative medicine, we can go in there and help to rebuild and repair some of the tissue in that area. It really is just an amazing form of treatment we can use. So PRP stands for platelet-rich plasma. And what we do is we draw an individual's blood, we spin it down, we concentrate the platelets, which they decrease the bad inflammation, so they're anti-inflammatory and pro-vascular. So they get rid of the bad inflammation and they help bring in the good nutrients to help heal the damaged tissue. We concentrate that and then we inject the good stuff back into the damaged area. Whether it's in a joint or in a muscle, it really is phenomenal. It's something that we've utilized for several years in the clinic and seen some really, really great results. It's something that pretty much every major league, baseball team, NFL team, hockey team, all the professional athletes use it because they realize they don't want to have surgery. They don't want to be down for 6 months or 12 months, right? What happens is when they get injured, they want to use something that is not going to get them addicted, a strong pharmaceutical. They don't want to have surgery, and PRP helps do that in a phenomenal way. So where can this be utilized? Pretty much almost any joint and muscle in the body. Almost any joint and muscle in the body, PRP works wonderful at repairing the damage. I used the tire analogy earlier, and you can go to the tire shop, they'll fix the alignment, and you can even buy a new tire so the tread is nice and thick again. However, you can't go buy a new joint, you can't go buy a new back. Those things just don't work. However, it's 2021 and we now have access to healthcare research and technology in the form of regenerative medicine and PRP to help repair damaged tissue like we weren't able to in past years. It really is amazing what we can do now to help repair the damaged tissue. Again, it's something that we've seen a lot of success with here in the clinic. This is one of the patients that we've taken care of in the past. Her name's Heather. She came to us because she had extreme pain in both knees. She was told you need surgery, specifically a knee replacement in your right knee and in your left knee. All right. She was using assistance for walking. She said she was on the brink of going into a wheelchair. However, because of a separate medical condition, she wasn't able to have surgery. They said, look, this is just not an option. Because of this condition, we can't operate on you. However, you're just out of luck. You're going to be in a wheelchair and life's just really going to be, it's going to suck for you, Miss Heather. And they sent her on her way. Well, fortunately, she did not accept that answer. So what that really means when you hear that from a doctor as well, when a doctor tells you you're out of luck, there's nothing that can be done, what they're saying is, with the knowledge that I have, with my understanding as a human being, there's nothing that I can do for you. It doesn't mean there's nothing out there. It means there's nothing that they can do. I can't tell you the amount of times over the years that a patient has come to see me and they said, my doctor told me there's nothing that could be done about it. I said he is absolutely correct. With his knowledge and his skill set, there's nothing that he can do or she can do about your condition. What you need to do is you need to find someone who has a different specialty. And I'm glad you're here because we look at things differently. So we're able to do some regenerative medicine treatments, and now pain-free. No walker, no wheelchair, right? Even recently, we saw her walking across the parking lot just a few days ago. No walker, no wheelchair, and it's been several years now. So it really is amazing the things that we can do with these new treatments. And now a few other considerations. I talked about the big three: fix the alignment, retrain the muscles, repair the damaged tissue. But there's other things that we need to mention just briefly when it comes to repairing pain, stopping pain, helping your body heal. And that includes diet, rest, and mental health. Three important aspects I'll touch on just briefly. When it comes to diet, there are foods which will inflame your body. Things like high sugar diets, gluten, dairy, fried food. Your body does not like those things. I remember several years back I had a patient who, whenever he had fried chicken, it would light up his joints like a Christmas tree. Like, he would just have pain. He's like, oh my gosh, I went and had fried chicken for lunch, and I was like, why did you do that? I was like, we've talked about this before. You know, whenever you have fried chicken, that night you are going to hurt in all your joints, right? Because it happened time and time again. He just was really sensitive to that. So do your best to reduce and avoid these type of foods, right? The sodas, the French fries, the hamburgers. I'm not saying don't ever have it, but you want to reduce and minimize the exposure to those things that you're putting in your body. These things will not help you heal. These things will slow down the healing process. So again, you're in pain, you're trying to get better. These things are not your friend. These ones are your friends. You need what's known as a low inflammation diet. Really, it's just eating healthy. Like, we've all heard that fruits and veggies are good for us. Doesn't mean we eat them all the time, but we know they're good for us, right? We know that lean sources of protein, whether it be salmon or chicken, we know that's usually a healthier option. Most of us also are aware of good fats like avocado. So stop consuming the things you know are not good for you and eat the things you know are good for you, because that will help your body heal on the inside. Remember, if you have a pain, that means something's damaged. Your body needs the proper ingredients through a good diet, the vitamins, minerals, and nutrients to heal the damaged tissue. Next, rest. This is from the University of Michigan School of Public Health. Rest is probably one of the most underrated things when it comes to our health and pain, and least talked about. This is from, again, University of Michigan. Sleep is essential to every, highlight, bold, capitalized, every process in the body affecting our physical and mental functioning the next day, our ability to fight disease, develop immunity, and our metabolism and chronic disease risk. Pretty much every health condition benefits from a good night's sleep or rest. Now, the magic number for most adults is 7 to 8 hours. You know that. We all know that. If we wake up and we feel good, or if you wake up and you're like, oh my gosh, I need coffee, right? It means you didn't get a great night's sleep or rest, right? If you got 4 hours of sleep and you're dragging through the day, you know that's not good. 7 to 8 hours of sleep. Do whatever you need to do to go to bed, because you know what time you have to wake up. So just do the math. If you have to wake up at 6 a.m., make sure you're in bed by 10 p.m. to get those 8 hours. Again, 7 to 8 hours is that window. I promise you, it will help you in every single aspect of recovery from pain. Even when you're feeling great, it will make sure that you keep recharging every night. Most people wouldn't dream of going to bed without recharging their cell phone. They wouldn't, because they know, I need my cell phone to be charged the next day. Think of sleep as your body recharging the cells in your body. Next is mental health. Specifically, we call it psychoneuroimmunology. What that means is your thoughts affect your nervous system, which affects your immune system. And your immune system is responsible for healing the damaged tissue. Again, when you have a damaged, whether it be a torn muscle, arthritis, degeneration, a pinched nerve, bulging disc, your immune system is the system that's responsible for coming in and healing those. And so the study is specifically the links of mental health and physical health. Bottom line, when you're in a good mood, right? When you're positive, you're healthier. When you're negative and down, you're not as healthy. So here are a few things to help improve your mental health. If you're into prayer or scripture study, make that part of your daily routine. If you're into meditation or early morning walks or spending time in nature, we're close enough to Lake Conroe, we're close enough to the forest, which is just maybe 30 minutes north of here, right? There are plenty of opportunities for us to be out in Mother Nature. And I say morning because you don't hear cars, right? It's not chaotic. Usually those are the peaceful times. Hang out around positive people. And you know when you see that person on your caller ID, you know if it's like, hey, this is a fun person, I'm going to answer because I always have a great time when we're together. You also know when that other person pops up on caller ID, you're like, oh, they're probably going to complain and drain my energy. Yeah, let's send them a voicemail, right? So hang out around positive people that lift you up. Also, do your best to be one of those positive people for others. Learn something new, a new habit, a new skill, all right? It's just something fun. The key is you just want to have fun, because the more fun that you have, it will help your mental health, which helps you heal, not only from pain you're having, but big picture as well. Now, I want to show you a couple of the patients we've had over the years. If you can see this, I know that the light may fade it out a little bit. Yes, she is standing, right, on her hands. The picture is not upside down. That is a handstand against the wall. This specific patient, her name's Renee. In 2001, she had a neck fusion. So they took some screws and bolts and brackets and put them in her neck. And for 10 years after that, she lived in chronic pain. She would receive injections multiple times a year, and every couple of years they would burn the nerves in her neck. Because she was feeling pain, they're like, oh, if you have pain, no problem. We'll just burn the nerves in your neck. Then you won't feel the pain anymore. Again, she didn't know any better because she went to those doctors, and that's what they did. And they said there's nothing else that can be done except injections and burning the nerves. Well, she carried that course for well over 10 years. And fortunately, she was referred to our clinic because she was still living in pain, even with the burning nerves and injections. And it was time to burn the nerves again. And as our paths crossed, we said, look, we looked at her x-rays and MRIs and said, look, there's something that we can do, right? There's something different, right? We can help fix alignment, retrain muscle patterns, and so forth. And so we started going through treatments, and when this picture was taken, no more medication, and she started doing CrossFit. Something she wouldn't have dreamed of when we first met because she lived in so much pain. Now she was an active CrossFitter, and she was really excited to take a picture doing a handstand. All right? This is another patient we've taken care of. His name's Sergio. He was injured in the Army. All right? Lived in constant pain medication daily. Right? One of his things that she wanted to do was wash his car. I know it sounds simple, but he's like, I just want to be able to go wash my car. I can't do that because I'm in so much pain. Right? And he thought there was no hope. Again, he went through the VA system, saw other doctors, and they were all like, there's nothing we can do for you. Unfortunately, you were damaged in the service. Take the pain meds, have a nice life. He battled depression because he couldn't provide for his family, couldn't wash his car, spent most of the time on the couch. Right? He came, our paths crossed fortunately, and we were able to go through some different treatments. We helped him get off the pain meds, and at this time the picture was taken, no more pain meds, and it was the day he came in and said, I washed my car over the weekend, and it didn't hurt. Like, he was just so excited coming and telling me that. I washed my car, and it didn't hurt. Right? We have hundreds and hundreds and hundreds of more stories just like this. People who thought that there was no help for them, people who'd been in chronic pain, but we were able to help because of our unique and different approach. As I mentioned up front, our goal was to do two things today. Number one, to educate you on treatments you may not have been aware of when it comes to treating pain. And number two, to be a resource to you. To be a resource to help you get the treatments you need to get out of pain, get off pain medication, and avoid surgery. And if it's something that we can't help here, then we have relationships where we can point you in the right direction within our community. If you're watching this right now, if you're listening to this and you're in pain or a loved one is, please reach out to us. We are here to help you. That's the whole point of today's workshop on chronic pain alternatives to opioids. So many people just don't know that there's an option. That's why there's an epidemic. That's why there's a crisis. They didn't know they had another option. They thought the pain medication, the pill, was their only option. Help us get the message out that there are safe and natural options to treating pain that work wonderful. So our contact info, you can reach us at 936-494-1222, or you can also pull us up on the web at backpaincenteroftexas.com. Thank you for your time today, and we wish you guys the best in health and wellness.